Will my child need braces? That's a question dentists are commonly asked. There are many options in pediatric dentistry, and some include orthodontics. To discuss the scope of child dentistry is Dr. Brian Stein of Pathways Dental. This is Daily Web TV. Will my child need braces? Well, that's the question I'm asking Dr. Stein of Pathways Dental Care here in Ancaster. Dr. Stein, question all moms and dads probably ask you, will my child need braces? So how do we know if our child needs braces?
Well, basically there's two aspects that we look at when a child needs braces, and one is the physical. You know, we look at their growth and jaw development. Do they have cross bites? Do they have habits? But basically, is there going to be enough room for their teeth to fit, their adult teeth to fit into their mouth? The second thing we look at is their emotional state. Are the children ready for that responsibility of orthodontics? Because if they're not, you can get less desirable outcomes, longer treatment times, and you can even get into getting white spots on their teeth or even cavities around the teeth and braces as a result for the responsibility for oral hygiene.
Exactly, it is a huge responsibility for the child because it's not something that mommy and daddy can do because they need to show that, hey, they're ready for this. I totally understand that. Now, as a mom, I know my child needs braces, but how much is it going to cost me? Because it can be rather expensive.
Well, the prices can range, but you can minimize those prices if you can catch things earlier. Basically, when the adult teeth start to come in. It's almost like partial braces. So basically the point is to try to get the right template and foundation so that the rest of the teeth can come into their proper position and alignment, so that later on you won't need the full braces.
Oh, so preventative dental care, again, preventative maintenance with our dental care can help reduce the cost if my child needs braces.
You can catch things even earlier, because earlier in development the tonsils and adenoids can affect the growth and development of the teeth and jaws as well. We find that the lips and the muscles and the tongue and the cheeks, if they're all in the right position, the jaws and the teeth can grow in a better fashion to get the right balanced bite and room for all your teeth. If you have enlarged adenoids and tonsils, what happens is your lower jaw can grow in a more downward fashion because you're trying to breathe more through your mouth and not your nose. And the tonsils push the tongue forward, so it's not resting on the top jaw, and the jaw, as a result, shrinks in, creating less room, cross bites, deviant growth patterns. So that long term can result in higher costs down the road.
Wow, things that I didn't even think about. Talking about, you mentioned the emotional state of the child. I know personally I was younger when I had my braces. I was ready for them. I was at an age where I was able to take responsibility for it. But emotionally, it's hard being either a child or an adult with braces. How do you help somebody where, you know, they need it, but it's, again, being picked on, people saying, look at your braces? Well,
there are other options that you do have. Some people just don't want the metal mouth, so to speak. There is what's called Invisalign, which are basically invisible type braces. They're basically retainers, a series of retainers that you wear over time that move the teeth a little bit at a time. So when you actually snap them in and you wear them, no one can really tell that you're actually wearing braces.
Wow.
There's also another thing that you can do, which we call instant orthodontics. And that's if you have some crowded teeth and you don't like your smile, but you don't want to even go through any of the braces, including the invisible braces. You can do crowns and veneers that are all porcelain, so that it's really just 2 appointments. You prepare the teeth, and then the next appointment, you get a nice, straight, beautiful smile.
So we have more options than a mouth full of metal.
That's correct.
Well, thank you very much for easing my mind on braces.
You're welcome.
For more information on Pathways Dental Care with Dr. Stein, visit their website. Connecting you to your local community, I'm Tracy Bizot, and this is Daily Web TV.